things about our country, about our medical education, I also need to give you some solutions. And I will take only 3 more minutes to give you the solution. One is, we need to get the right people into the medical education. That means the medical students. You need to have an aptitude test. Every student who is simply appearing through a competitive exam is actually not fit to be a doctor. So there has to be an aptitude test as part of the selection process. And it has to be given at least 33% of the marks. If you don't have the aptitude to be a doctor, you shouldn't be becoming one. Number 2, the selection of medical teachers. Medical teachers is a very serious business. Teachers themselves are a very serious business. Teaching is not an ordinary profession. Teaching in our own Vedas and history has been always referred to as the most revered profession. And we take our medical teachers as nothing. So we need to improve a way where the brightest minds become the medical teachers in some form or the other, whether they are part-timers or full-timers, but the brightest, the best academic background students and doctors should be the people becoming students. We need to change the teaching methods. When I see a medical exam, they put up the most rare patient for an MBBS exam. For example, I am sure there are a lot of doctors here, and we've all gone through the exam. So in MBBS, they will put up a patient with mitral stenosis as a case. Now that's ridiculous. Why does the MBBS need to know how to diagnose mitral stenosis? An MBBS fellow should be able to diagnose cholera and typhoid, or have a line of managing how a patient with pyrexia is. So instead of having common problems first, we are putting up the rarest of rare cases as a case in the exam. So we need to change examination system. And whether we like it or not, we need to get the best doctors in a particular town somehow into the medical college teaching. And that's actually not difficult. You may be aware there is something called Rajiv Gandhi Yojana, which basically allows poor people to take advantage of this scheme. The government pays 1.5 lakh rupees to a low salaried worker with which the cardiac surgery is performed. Now all the Rajiv Gandhi patients in Maharashtra are being done in private hospitals. Obviously to take out 1.5 lakh rupees from the government is not easy. It's like trying to get milk out of a bull. So how does that happen? The private hospital has an agent who is hand in glove with the clerk in the Mantralaya. So he takes out 25,000 rupees. That means the patient actually gets 125. The hospital actually gets 125. Imagine doing open heart surgery at 125 and the surgeon still getting paid in a private hospital. So obviously it is one of the most corrupt schemes in Maharashtra today. Everybody knows about it. We want to keep our eyes closed to it. So we need to create in some form some kind of private beds in public hospitals so that the public hospital doctor, the public hospital surgeon has an incentive to perform in the public hospital. And lastly, I also feel that the hospital CEOs and the top doctors of top hospitals should in some form be involved with the health minister and its regulations, because they are the most competent people, they are the people from the field, they see the problem day in and day out, and they are the best people to guide rather than an IAS. IAS fellow knows nothing about health problems. He knows nothing about health administration, and he certainly knows nothing about problems facing the doctor. So it is the healthcare professionals, both on the management side and the actual doctor, who in some form should be involved with health minister and his health ministry to formulate future strategies, not only for providing top-class medical care to the patients, but to also generate top-class world doctors. Otherwise, we will be left with very, very mediocre hospitals which are dwindling. Thank you very much.
Thank you, Dr. Pandey. Any questions for Dr. Pandey? It was a lot of eye-opener there. Yeah.
Yeah, what you're saying is,
Suggested you should suggest if not.
I have definitely never had the opportunity, but on various other forum, including Indian Association of Cardiac Surgeons, I have raised this question that we need to improve our education. Nobody is bothered.
Unanimously, if you try, it can be possible.
Okay, I'll take your suggestion.
Please go ahead.
Certainly, thank you. I will.
Yeah, I think Dr. Khanna has one more question here. Please, a microphone for him.
Lovely talk, Dr. Pandey, and fantastic statistics and insight to things. But the one big problem we have is that the best doctors of our country actually go abroad. See, America is run by a good percentage of Indian doctors. UK is run by a good percentage of Indian doctors. So they must be very good to be able to stand up or even be better than other doctors to have more faith by the patients. So how do you stop that? And that's also a very big burning problem.
Thank you for asking me this question. You've actually done me a favor by asking this question, because I had virtually settled down in Melbourne after my 4-year training and had shifted to Brisbane because the weather conditions were much conducive and Melbourne weather wasn't the best. The only reason I came back was persuasion by Lieutenant General Banga, who was the CEO of Hinduja Hospital then. He kept at it. I didn't have fax. The fax was there only in the hospital. He used to write me one letter every month persuading me that people like me need to come back to India. So even if one person out of 50 came back, we can still make the difference. And when I see the analysis, yeah, the best ones are still going to America. But you know, today, America, thanks to Obamacare, the cardiac surgeon in America is actually no more what a cardiac surgeon is like us or was in America. The cardiac surgeon salary in America has been capped, and capped at very low levels. Today, most of my friends who are in America are only earning $250,000 to $350,000 per year. The best one is also touching only $500,000. $500,000 is nothing when you live in America. $500,000, a lot of people, I'm sure you included, are making in India. So today, even that is changing, that there are enough reasons for the best to stay behind. But I agree that the quality of life, the quality of education, the quality of research ability in America is tremendous. And if I were born again, I would say I should be born in America. Even today, I would think like that. So America does offer that. And it is simply because of the quality education. I'm just speaking my mind out.
What is the remedy then?
Good question. Very good question. What's the remedy? The people like you who are top in your field. And I'm sure I heard 2-3 other doctors as well. The health minister should have been here, at least of Maharashtra. I have actually operated on 2 of his brothers. Do I still have a say? The answer to that is no, because the system simply doesn't allow it. That means we first need to create a system that my voice be heard. So this is the problem, that similarly you are fighting a quack. Now it's a very uneven fight. How can you fight a quack? His levels of integrity, his levels of professionalism, his level is completely different to yours. When you talk to an idiot or when you talk to a stupid fellow, that means you brought your level down to a stupid fellow or idiot. Why will I? Why should you fight a quack? So if I were you in the next presentation, don't fight that idiot, because by showing that slide, we are bringing, me are bringing our level to level of that idiot. It's wrong. This is where the regulation counts. Today, even in Mumbai, I know of at least 2 surgeons, practicing cardiac surgeons, who don't have the qualification, to practice cardiac surgery, but they're practicing. Can I do anything about it? Moment I say something, there will be 10 other cardiac surgeons who will get me bumped off. So, there is a problem. We don't want to be regulated. We don't want to be regimented. If there is one solution we need, our country needs, is quality education and it be regimented. That means if a plastic surgeon wants to become a hair transplant, in the 3rd year of his MCH, he should be allowed to at least perform 100 hair transplants before MCH degree is conferred on him, that yes, he is certified. In United States, in the 3rd year of training as a cardiac surgeon, you have to perform 100 open heart surgeries. It is mandated by the American board. Then only he becomes, so the day he passes his MCH, his American board exam, he becomes a consultant. Whereas in our case, we pass MCH, and we can't perform even the simplest operation. We then work for another 3 to 5 years. Imagine spending 3 to 5 years of your youth. I just didn't live. I gave away my youth to my training. So seriously wrong. This is a serious problem. And I really urge people in the audience, you are all in a situation where you can make a difference. Please help people like us. Please help all of us to find a way to improve medical education. Otherwise, idiots will be treating us 10 years from today.
On that note, yes, to improve education. Thank you, Dr. Pandey. And may I request Satya to hand over a memento to Dr. Pandey,
Hello.
please? Oh, sorry, somebody had a question? Okay, one last question, please.
Yeah, last question. So you have spoken about the quality education in like medical and even I'm from pharmacy college. So normally what happens like when there are some inspections going on, like MCI come, like Medical Council of Education of India will come and Pharmacy Council of India, AICT and all these technical bodies comes and they do the inspections in the private colleges as well as in the government colleges. So normally what happens like during the inspection time, everything will be, it is just to show off. And rest of the time, as you said, so like how to, go for it or to betterment of it, because inspectors comes, they do the inspection, they sign the documents and they just do go off. Two days they are there in the college and that's it. So everything is fine that time. So at this time, like whom to address and how to proceed for it?
This is a very important problem facing our country. Day in and out, we have inspections and there are no teachers. So that day, teachers are brought from another hospital. There are no patients. So patients are brought from another hospital. You know it and I know it, but the health minister doesn't know it. Government of India doesn't know about it. You know it and I know it.
But sir, the inspectors are, appointed by Government of India, no? Like they fill the form and then the sanction come from the Government of India only, from the Health Ministry or, the Pharmacy Department.
Next time this inspection occurs, what you do at the end of the inspection, just frisk the inspector. He will be having 20 lakh rupees in his pocket in cash.
It is there.
Yes, yes. So when we know all this, so can I say all this to Mr. Modi ji and expect Prime Minister
That
Modi
is
to
what
act?
actually to how to proceed for it, to
Exactly.
betterment of the quality.
Can I write a letter to the Prime Minister that your DG Medical Services took 3 years to give sanction to TAVI with preconditions which are not possible? Can I? So my answer to all this is just improve yourself day in and day out. Maybe a day will come, there will be lots of improved individuals in our society and they will make the difference. And I'm
Yeah,
sure
on that note of improvement, if you may probably move
Thank you,
further.
doctor. You keep it up.
Okay, one last thing I'll
Fine,
still take. Yeah, okay, one last one,
Sir,
please.
just love what you spoke. Awesome. After a long time, saw somebody talking so upfront with so much of courage. So great, we learned a lot. Coming to the point that we all come in panel discussions, we talk, we all learn something, then go back. What's the use of panel discussions when there is no concrete productive activity that can come out, right?
Absolutely.
So being from media, what I can say, as an Indian citizen, there is something called power of communication. And there is something called taking initiatives. Yes, we all have to improve by ourselves individually, but we are not Buddhas and we are not in the healing meditation zone as of now. So, sir, if you would permit, then definitely we could create something, and communication, the power of communication can definitely lead to at least one step towards what you are aiming at. Trust me on that.
So
So
you
if we can work out on that, it will be great.
You can count on me. I will, whatever I spoke, my letter in writing would be 100 times more powerful than that.
Okay, so in Pharma Leaders Award, Satya, we will get that letter and let's take an initiative, and I'll see how many people from here would join hands to make some things work, maybe some difference at least, yeah?
I can answer
Thank
that
you.
question. Other than Dr. Kaushal Pandey, I don't find anyone who